Why are you telling that, sir? I don't understand that basic thing, sir.
Near to the eyelashes.
Near to the eyelash.
Eyelashes.
Here.
Yeah.
Nothing happens, sir. You see, I told you no. If at all the mole is over here, you remove it. The suture, you put it like this. It won't happen anyway. So if you are going to have a suture like that only, it will become a problem. You put a suture like this, no problem. Just one bite. That's it. Sir, you see, you are going to put a suture for only the skin. You need not go in for deepest tissue. If you are going to go in for the deeper tissue, you will end up with a scar, one. Two, you will end up with other things. Just a superficial thing.
Sir, for the mole you have done with the punch biopsy, sir.
Yes.
Sir, with the radiocortic we can do it without any stitches.
No, sir. Please don't do it, sir. Please don't do it, sir. People tell that we can't remove a mole with radio frequency. No. And mole with the laser, no. Because there will be a different recurrence. What I am telling is a practical thing. 100% cure, nothing will recur again.
So what the thing happens with the radiocortic if you do it?
Sir, it can end up with a scar, one. Two, the deeper remnant we don't know. The whole remnant, I told you, that the feeding vessel has to be cut out.
Sir.
In a radio frequency, you won't go to so deep. The feeding vessel will be there. There will be small amount of nervous tissue. Again, it's going to go.
So, but like a lot of cases I have done, sir, no any scar and no any.
Sir, if it is a small mole, yes, okay.
Sir.
But practical purpose.
Sir.
What is safe, what is good,
sir,
is just a punch excision.
Okay.
Right, sir?
Okay.
Now we are going to go in for chemical peelings. I told you the pre-peel and all. What I am using is resorcinol. This is a resorcinol thing, sir. Right. Now we are going to do trichloroacetic acid. Why I am using resorcinol in my private practice is the post-inflammatory episode is very, very smooth, sir. It will be a pleasant thing with this one, resorcinol. It's costly. All other things will be a little bit cheaper. Trichloroacetic acid will be the best. Cheaper, best, longer shelf life. Trichloroacetic acid will be the best because you can do a spot chemical peel. You can do a chemical peel for the whole face. The only thing, liberal application of this peel will be good. Liberal application. Just don't touch. Don't bother. Nothing happens. C for the stinging sensation. C for the erythema. C for the frosting. Once the frosting comes out, you stop. TCA neutralize with calamine. The best neutralizer for any TCA will be calamine. And for other things will be just saline. Glycolic peel, as such, if the patient is going to expect too much from us, don't go in for a glycolic peel. Glycolic peel is only one thing, it's safer. It is very, very safer. But trichloroacetic acid, we have to be a little bit careful. Otherwise, it's real good. I prefer trichloroacetic acid over anything. If at all you want to have a real peel, just apply, wait for some time, tell the patient that it will peel. No, nothing. You want to have a result, use TCA. Tell them that the skin will peel off, the skin will wrinkle, there will be a small amount of constriction over the face, people will understand. Within 4 days, everything will peel off. From 5th day, we can start the therapy.
What's your opinion on the melanocyte transfer technique?
Sir, that's why I told you,
how far
sir.
it is useful, and what about one melanocyte, pigmentation comes around?
Sir, he started this technique before 4 years. Right? It was a big failure, sir. I told you we had a study along with a Japanese university. But we were not able to grow and we were exactly not able to transfer. You think that you have transferred a melanocyte, but you are going to transfer a keratinocyte. That's what happened, sir.
So you're finding difficulty only in transferring the melanocytes, or to separate the things?
Separate the things is very, very difficult, sir. That's why I'm telling, sir. Separating and growing, both are difficult. I don't know why it is becoming difficult, sir. We are able to grow everything, but not this structure. Sir, I tried in around 20 patients, sir. Right? Everything was a disaster. 1 or 2 may be a success, sir. How it becomes a success? You do a dermabrasion or a punch over one area. That itself acts as a treatment. You see, basically any skin problem, there is one theory that the chelons, the inhibiting substances which are present in the skin only produces problems. You remove that inhibiting substances by doing any technique, either needling or dermabrasion or anything, it even pigments, right? Peeling with trichloroacetic acid, peeling and all is a minimal technique. Pre-peel, during the pre-peel with retinoin, 15 days, peel, first, wash the face, use ether. One side we are going to use trichloroacetic acid, the other side we are going to use glycolic acid. I told you TCA, best. Old is best. When I tell old is gold, one of my colleagues, Dr. Rajagopal, is sitting there, sir. He'll be very, very happy. A man with young activities. He has come all the way to join us. Very happy to see you, sir, Dr. Rajagopal, sir. He is a captain. He is practicing along with me in Apollo Hospital, sir. This you won't be able to get with your glycolic acid, sir. If at all it comes, it takes a lot of time. Time is very, very precious for us. See that frosting? Stop the procedure, neutralize with calamine. Neutralize with calamine for TCA. We will start the second session with Botox and fillers. Botox, as you know, we get it from Clostridium block. It can be used in 3 conditions, Botox. 1, to reduce the wrinkles over the face. Otherwise, dynamic wrinkles. When I tell it to be dynamic wrinkles, not the old age one. Dynamic wrinkles. Wrinkles caused by any trauma, wrinkles caused by any other cause, we can't remove. Only dynamic wrinkles. Dynamic wrinkles are wrinkles caused by muscle overactivity. One muscle overacting the other muscle. Whether it can be procerus, it can be corrugator. So, that type of muscle overactivity we can paralyze with Botox and reduce the wrinkle. This is 1. 2, palmoplantar hyperhidrosis. Palmoplantar hyperhidrosis, one treatment is iontophoresis, the other one is Botox. If at all the patient is not responding to iontophoresis, we go in for Botox. How do we go in for to that? See, for one hand, not above 40 units. Not above 40 units. Not closer to the lateral margin. Not closer to the lateral margin. So, you inject 1 centimeter apart, 4 units, 4 units, 4 units, 4 units, 4, 4, 4, 4, like that. So, not exceeding 40 units. If you exceed 40 units, what happens? It becomes so dry and the patient becomes, it produces something like a tingling and burning sensation. So, to avoid that, 40 units here. Same way you can go in for 40 units there. In the wrinkles, there are only 2 things which to be seen. Above the eyebrow, 4 units everywhere. Below the eyebrow, 2 units everywhere. Whether it is a nasolabial furrow or anywhere below the eyebrow, crow's feet, 2 units, 1 centimeter apart. But above the eyebrow, you can go 4 units, 1 centimeter apart. The other thing is, don't go near any orifices. 1, 2. Don't go near any orifices. 1 centimeter away from all orifices. This is the basic. This is the practical point of Botox. 1 centimeter away from the lateral margin, 1 centimeter away from the orifice. 1. 2. Above the eyebrow, 4 units. Below the eyebrow, 2 units. Not exceeding 20 units for a face in one sitting. Not exceeding 20 units for a face. The main thing is, if at all you want to remove the wrinkles over here, remove it. Give a gap of 1 week, 10 days. When this goes off, next week you can go for the second sitting, but don't go above 20. Here, not above 40. Third use of Botox is breast augmentation. Breast augmentation, how do we do? Pectoralis major forms the chunk of the breast tissue, 100%. But 25%